Oh dear. In we come. In we come. No John today? Have you got your new teeth?
Yes.
God, they're much better than the old ones.
I know they are.
You look great. Are you happy?
Yes.
I think they're great. Oh, that's very
Thank
kind
you.
of you. That's very kind of you. Let me get this chair out. I've known Peggy for probably 17 years. As soon as I started the practice, I got to meet her. She suffers badly from quite extreme osteoarthritis, which has affected most of her joints over the years, particularly her back. And when I started doing acupuncture as a treatment, then she seemed to be a perfect client for this type of treatment.
Before you start sticking me,
Yeah.
this calf
Yeah.
has really been hot and swollen.
Yeah?
And but I don't know whether I've overdone the gardening or what I've done.
How long for?
Well, it's just about cooling off now.
Okay. When do you mean by that? Do you mean for the last?
4 days.
Right.
And I haven't been able to do a lot with it.
You can't remember doing anything to it though.
No, oh definitely not.
No.
I've been doing a lot of gardening. I'm just wondering whether I...
You didn't feel a pull or a snap or anything like that? So I've been using acupuncture now for about 15 years. I attended a course and was a little sceptical after coming out, but I gradually introduced it to my surgeries, and over the years have found that 70 to 80% of people get some effect from the treatment that we give them. If you can cut down on medication, if you can reduce their pain levels, then I feel that it's a successful treatment. God, and the hair's been done as well, isn't it?
Yes. Very noticeable today, aren't you, David?
It's not routinely used under the NHS unless you go into a specialist pain clinic or physiotherapist normally. In fact, I think there's only 2 of us in Slough who offer acupuncture as a service, and we do it off our own bat. Okay, let's have a look. Okay, so nice and relaxed, just let everything flop.
See, that hurts. That really hurts.
So all over if I
Yes,
did that, yeah.
yes.
Any specific point or not? Just
that.
all of it?
All that.
All of it, all the way up and down?
Yes. Yes.
Okay, that's your muscle, isn't it?
Is it? I want to talk about my toes. That one there now,
Yeah,
that's coming over here.
the overriding one, yeah.
And this one is coming over.
Okay.
Like that. So do I have to phone up and speak to him, or do you have to
I'd have
refer
to refer you.
Yeah.
I mean, the problem with that one is that you've still got a bunion of sorts here. Do you know what I
I
mean?
haven't had that done, have I?
Exactly. So it's in that direction. So this is a reasonably straight toe, but it's
Yeah.
this one's popping underneath it,
Yeah.
whereas that is just the most disastrous looking toe I've ever seen. Well, it takes a 90-degree turn, doesn't it?
Yeah, it
there.
does.
So
Yeah,
it's
yeah.
so that's very different. So that would be to do something with that joint.
Yeah. But I'm quite happy to have it done.
Whereas that one would be, I would be tempted not to do anything with that.
Okay.
Okay, because I think that would involve having to do this whole foot.
Yeah, and I don't want that done before I go away.
But that I think probably needs to. Is it causing pain?
Yes, and especially when I've got shoes, and I can't back to square one again. I can't get my proper shoes on.
All right, madame. What have we got? These sticking out here. Yeah. 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 Yeah.
So I'll see about 5 to 6 weeks.
Yeah, I will. So we'll send that off to you, and we'll get you back in
You're
again.
after the
Yeah. Look, let me help you. Well, what are you doing?
Dangling.
You haven't had a gym today, have you already?
No.
No. Okay.
Okay then, David. Have a lovely holiday.
I will.
Look after yourself over there, please.
I will.
Come on in. Have a seat.
Thank you.
Okay.
Oh, everything's been happening
Yeah.
for the last month. Angela's not been at their best
No.
with the chest infection and the water infection, which culminated in her having to go back to hospital because she had a fall.
Yes, I saw. Is she in hospital now?
She is,
She
yes.
is, right.
Don is the full-time carer for his partner, who sadly had a brain hemorrhage in 2010. Before that, she was perfectly well, and obviously this has been devastating for them both.
I mean, I would say come home straight away, but I wanted a social worker involved to help me because tired.
Yes. He has been looking after her 24/7 with the help of some paid carers. She is physically fairly well, but unfortunately has quite a lot of cognitive impairment.
I feel run down.
Yes.
I don't know if it's my tooth. I don't know if it's an infection I got.
Yeah.
Or...
If you open up wide, you've got quite a big swelling. I think you have got a dental infection in there, okay? So I think you need to go to the dentist. So do you know where you would find a dentist?
Yep.
Yeah. I'm just wondering whether we struggle to get you in to manage your health issues because of your responsibilities looking after your wife, okay? So I am a bit worried about you and your health. I think you're going to need a break, aren't you?
I need some help. Just some help. Really.
Yeah.
Because I can't leave her for 1 minute.
No.
But I do need some help.
Yeah.
Specifically culminating in doing something with my bathroom because,
Yeah.
I mean, anything that would help us, like a wet room or something like that,
Yeah.
would help her greatly.
Okay.
I'm hoping when I speak to the social worker that
Yeah.
they can at least push for a toilet downstairs because
Yeah.
most of the things that really goes wrong.
Yeah, it's all around toileting and washing.
Yeah.
Yeah. Okay, maybe I should do a referral too to occupational therapy, okay?
Yeah.
Getting a toilet that she likes is quite important actually, isn't it? When she comes out,
Yes.
maybe we should arrange for her to have a community nurse come in and just do a bit of an assessment, maybe
Absolutely.
around the waterworks issue
Yes.
particularly. You might want to think about
Yeah.
her having even more help, either at home or going into a home for a few days or a week, just every few months or so that you can have a break and you can look after yourself.
That sounds pretty... I know where you're coming from.
Don has very little time for his own health and has a number of health issues that we find it difficult to get him in to talk about. He has physical health problems, but he also is getting quite depressed and stressed now because the care and responsibilities are so huge. People who are full-time carers ideally need to make some time for their own health. This is very difficult, and we as a society struggle to support people who are carers.
You've been together nearly 30 years now.
I know. Well, you're very close and you've been fantastic looking after her. And really what I want is for that to be possible for many years to come. You've been soldiering on now for ages and it's really hard, you know?
I just got to never... I just don't give up. I've got
No.
to never say die attitude.
Yeah.
It's just soldier on, you know.
Yes.
I make mistakes just like any other people do, but
Yeah.
I try my best to learn from them.
Yeah.
It's not always down. I mean, we have some tremendous time.
Yes. OK, so you just let me know, all right? And you get your teeth sorted, yeah?
Okay, I'll try to
By
get
the
that straight away.
experts, OK?
Okay,
All
thanks,
right.
Doc. I'm glad I had to speak with you anyway.
That's all right, yeah. I think it was
Necessary.
the right time for that, wasn't it?
Yeah,
All right.
absolutely.
OK, bye
Thank you,
now.
Doctor.
Hi, come on in. So, how you doing?
Disaster.
What's the problem?
Oh, it's just everything. Everything's going wrong. The dog seems to be dying. Can't do anything about it.
You've been
Well,
seeing that?
he's 17, so
Oh, okay, but it's still sad.
but he's incontinent. He keeps having accidents in the house, and I don't know. I sort of think, well, he walks about and loves his dinner. But am I being fair? You know, but I'm putting up with it at the moment.
You can talk to the vet, yeah?
Yeah. And then my neighbour's just doing my head in. Parties nearly every night. They're out in the garden. There's just no peace and quiet at all.
You're going to do something about that if it's causing you stress, yeah?
Oh, it's just doing my head, honestly.
Any thoughts of moving?
Well, I've spent so much. I've spent thousands in the garden.
You need to take control of that one, don't you, David? You can start to get some help.
Yeah, so my blood pressure has sort of gone out the
Have
window.
you been checking your blood pressure at home?
Last time I checked, it was 192, so I put it away.
Let me do it today. Have you ever had talking treatment? Talking therapy?
No, I haven't.
How would you feel about talking to someone about your stress levels?
I wouldn't mind, I suppose.
They'd start with a telephone call to you, and sometimes they do it all on the telephone. Would you be all right with that?
Yeah.
You're taking your pills, aren't you?
Yeah.
I have to ask. I'm sure that everything you've been telling me about isn't helping with this, but with your history, we can't leave it this high. In your case, we need to take no chances, yeah? Have you had your bloods done? Have you checked your calcium levels and your vitamin D?
Yeah, I think so, a little while ago.
I'll put some bloods on the system, okay? And I'm going to give you a 10 milligram bisoprolol. We're going to get you back next week to check your blood pressure, okay?
Okay.
And I'm going to do a referral to get you some talking therapies, okay?
Okay.
Good.
Thank you, Dr. Bulger.
No problem. You take care.
Sorry to have...
Don't be silly and make those calls, yeah?
That's it.
Okay, so how you doing?
The levels are still a bit everywhere.
Right, because we... have you had bloods done or not? Here?
Not recently. I don't
No, the last one we've got is horrible, but it's a long time out of date. You're due some more, aren't you?
I think so, yeah.
Yeah, okay. And they are everywhere, aren't they? So they're all... There's loads of 20s, yeah? There's no lows that I can see there. Are you having any hypos?
I had one just before I come.
Today?
Yeah.
Right. Are these any better than they've been?
Yeah, it's everywhere still.
Okay. You know that I need the diabetic specialist to have a look at you for this, yeah?
Yeah.
And we need them to see you sooner rather than later, don't we? Tell me how much insulin you take.
Well, I take 11 minutes in the morning, and then I have like between 18 or 24 or 26 of the Humalog with the 11 in the morning.
And then at lunch,
It's about 24, 28. I put it up to 28 lately.
and what about your evening meal? Is that your big meal of the day?
Yeah, if I have that, I take about 30 of that.
Are you not eating regularly?
No, I've gone off my food for about 3 months now.
Do we know why?
I'm suffering from depression as well.
What are they doing about your depression?
I'm on 40 mg of citalopram at the minute.
Have you had any talking therapy?
Not yet.
Would you like to? Is there anything going on that you need to talk?
No, I'm just not motivated to do anything. I don't know what's like, in particular.
So there's nothing particularly worrying you? Would you like to talk to anyone about the diabetes? Because that can be tough living with a long-term illness, can't it?
Not really, I'm just fed up of it being high, but I guess everyone gets fed up.
Some people find the confines and the complications of something like diabetes very difficult to deal with. It's a lifelong diagnosis and it affects nearly every aspect of your life. Having a chronic condition makes you depressed, and being depressed makes managing a chronic condition much more difficult, and the two are very definitely linked.
I'm going to send you back to the diabetic clinic. There's blood tests on the system. Will you book them for me, yeah? Here, yeah. In fact, let's get you a blood test now, and then I can send you back to them when I've got the new results, yeah? If you change your mind about talking to someone, if you change your mind about talking to anyone around the diabetes, you get a message to me?
I will do.
Are you seeing anyone again about the citalopram?
Not that I know of.
What about hurting yourself?
But I had a hypo fit at the end of March.
Sarah had several admissions which have been directly related to her uncontrolled diabetes. Hypo is when your blood sugar drops. So if you think about when you feel really hungry, that horrible empty feeling, but magnify it so people feel trembly, shaky, sweaty, often become confused. In its most extreme forms, hypoglycemia will lead to coma and, if untreated, to death.
I don't have the intention to hurt myself, but if something like that happens, so just let it take its course, basically.
That sounds horrible. You've been diabetic long enough to know that if you're not looking after yourself properly, then you are at risk of hurting yourself, aren't you?
Just not feeling new to eat, but I'm forcing myself to eat now.
Not taking control of diabetes, not managing your diet, it's self-harm by neglect. So diabetics who are struggling with motivation will often say that they wouldn't deliberately do anything to hurt themselves, but sometimes they really just can't be bothered, and they're aware that that will then have an impact on their health.
What should we do next? What could we do next to help with that? Why not talk to someone?
Not really anything to talk about except for I'm just fed up.
You think it's tied into diabetes? Might be an element of chicken and egg, mightn't there? You're feeling rubbish, so it's hard for you to keep on top of your diabetes. Your diabetes is rubbish, so that makes you feel depressed. Will you come back and see me after those blood tests? And will you stay on the citalopram until then? And if you change your mind about talking to someone, will you let me know? You don't have to wait for the appointment to do that.
Okay. just phone up and say, can I make an appointment with Dr. Gold?
You just phone up and say, I'd like Dr. Gorder to give me a ring. And we crack on and we get the diabetic people to see you and try and bring your sugar down. Does that sound like a reasonable plan? I will expect to see you in a couple of weeks, yeah?
Yeah, that's easy.
Bye-bye.
Right, so come in. Now, this is Leslie Black, who's our new doc.
Hello.
Come and have a seat here. No, I'll sit here.
Right, then we know where we are.
So that's where we are. So,
I had a thrombosis in this leg. Well, the same pain has come back. I thought I'd better get it checked out, simple as
Sure.
that. Because they're nasty.
how long ago did you have the one before?
1 year, 1.5, something like that.
Okay. And you took some blood clotting warfarin, probably, or something for 3 months,
I had
did you?
injections every day. Sorry, 6
That's right.
months. But it's not in one place. It's all up my leg just feels aching.
When did it start?
2 weeks ago.
Anything make it worse?
Long walks.
Okay.
Don't do long walks, I know.
And when you do a long walk, what do you get?
Aching, it's aching now.
So the other question I would have would really be about your circulation.
You know, I take, I'm a diabetic.
Yes.
And my feet are numb quite a bit.
Okay. Okay, let's have a look over here, if that's all right.
Do you want my,
Can you pull it up? Pull the trousers up. So this is a
no.
good start. I'm just going to my room to get the tape measure.
That's no problem. Learning, are we?
Yes, yeah, I just started yesterday.
Hey,
So I'm not very good with the computer.
neither am I. I'm computer illiterate, actually. I can crush a computer by switching it on.
So when you had a thrombosis before,
Yeah.
I expect you had a swollen calf.
The doctor spotted it straight away. There was no bumps or lumps or whatever.
Yes, so that's 237. I'm just measuring the size of your calf to see if it's much different. And it's about the same, in fact. This one's a little bit smaller. I'm just going to feel the pulses in your feet to make sure your circulation's all right, though because of your diabetes. This may have gone a long time ago.
No, they said you've got quite good feet for your age. I thought, thank you.
What is your age?
71.
OK, well, that looks fine. And the good news is I don't think it's anything worrying, but the bad news is I can't tell you exactly what it is.
Thank you.
I think if this grumbles on and on, we can see it again. But at the moment, it's a bit of an ache there. Nothing there to find, so wait and see what happens. Almost certainly, you know how aches come and they go. Is that all right?
Yeah, that's
But
fine.
you don't need to worry. We don't need to whiz you up to Southmead for the
No, I will.
DVT thing.
I'm glad about that. Thank you very much.
That's a pleasure. Nice to see you.
Have a nice day.
A few days ago, my boyfriend, he just noticed I have a lump in my breast. As you can't really feel it, but it's quite hard and it's small.
Okay.
So I rather to come and check. It's only because my father, he died on cancer 6 years ago, and I'm quite anxious with that. So
Yeah, sure. Okay. So you've never noticed anything before? Do you normally check your breasts? Yes. Okay. And you've got no pain or discomfort?
sometimes I can feel bad before
Yeah.
period, and you know,
Sure.
but
And your periods are regular?
kind of
Okay.
not very regular, but
Sure. And you're otherwise fit and well?
yeah,
Yeah? Any change in weight recently?
no,
Any family history of breast problems?
not as I know.
And you said your father died of cancer. What cancer was that?
Throat cancer, and after it was spread. And my mother, she had the cancer of the woman's stuff.
Okay.
And after she had the cancer over here, but
And how old was she when she had that?
45.
Okay. Chances are it's likely to be benign, non-serious, but even if it is, it means that it can be sorted quickly because you've identified it quickly. So you've done absolutely the right thing, okay? But try not to worry, okay?
Yeah.
Okay, so you're basically looking for any differences between both your breasts and see if anything, your skin tethers in or anything like that. And then you lie down. So just put your hand behind your head. So pretend you split the breast into 4 parts, and then you just basically work your way around each part, just having a feel. And then just any lumps. That feels good. Okay, just relax. So where do you feel the lump? Over here. Not sore?
And when you press it, I can feel it. It's not a pain as, very much, but it's like, that's why I was panicking, because I always make sure everything is good. And obviously when my boyfriend, he checked a few days ago, I was really surprised. It's something.
It's very little there, the knees where you probably...
But if you press it much, it's really painful.
Is
So,
it?
yeah.
Okay. Okay, definitely something there. That's fine. Get yourself dressed. Give me a shout when you're ready. Okay, so there's definitely something there. It's very small though, okay. I do think we should get it checked out, okay, so I'll refer you to the breast clinic. They will see you within 2 weeks. I don't want you to worry, okay.
Oh, I'm worried already, but...
Oh, okay. Common symptoms of breast cancer are a lump in the breast, perhaps noticing a change in the size of the breast, or finding a lump in the armpit. Pain is not normally a symptom of breast cancer. However, if women are concerned about pain in the breast, then they should definitely talk to their GP. So they will contact you definitely within the next 24 to 48 hours for an appointment. And you're available for an appointment within the next 2 weeks.
Perfect.
Yeah?
Because if not, I will,
No, if you don't hear anything by the end of next week, you definitely need to contact our patient services team here. Really important that you do that. Okay?
I will do.
In the meantime, try not to worry. Okay?
I will do.
Most likely things are all okay, but we should get it checked out.
Oh, yeah,
Okay.
of course, definitely.
All right, take care.
Lovely. Thank you so much.
Bye-bye.
Thank you very much, sir.
You too.
Are you still having pain now?
No, it's eased off now.
It's
I
eased
say
off
that's
now.
why that pain was. So I've not had it for about maybe 4 or 5 years. That sort of pain.
Really? So it's
Normally-
more severe than usual?
Normally
Yeah.
it just goes, and I take my spray and it's gone.
What time roughly did it happen then?
I would say about 5 to 3.
5 to 3, okay, fairly recently. Yeah,
Yeah,
okay, okay.
I phoned the hospital.
And prior to that, you said you don't normally get pain this severe.
No.
How often does your angina pain normally affect you, though? Is it something that do you normally have to use your spray
yes,
most weeks?
normally I have to use my spray. I go through quite a bit. Because
Right.
I'm waiting for you to see the heart specialist.
Okay, fine. Apart from your inhaler and your usual medications, have you taken anything else today?
No, the only other new medication I
Yeah.
have been taking is I was on citalopram, 4 milligrams.
And this pain, when you had it, did it move up to your neck or down your arm, or did
No,
it?
my
just stay in
my arm went stiff. I know that happens.
It went
quite,
stiff.
It happens
Okay.
quite often that way. That's why I took my pressure.
Okay.
Straight away.
So listen, what I'd like to do is do your blood pressure.
Right.
Have a listen to your heart.
Yes.
But I think what we also ought to do is get an ECG done. Yeah, you know what they are.
Yes,
the
I've had it,
stickers.
let me
Yeah.
know.
So one of my colleagues down the corridor will do that in a
Right.
second. Let's examine you first,
Right.
okay?
I really thought I was going to black out. That's how bad it got.
Really?
A double vision. That's not bad for me.
I mean, that's good.
Yeah.
But I'm still a bit worried.
Yeah, I know that.
Okay.
I'm very
Especially because
worried
you know in yourself what is a
Yeah.
normal angina
Oh,
pain,
yeah,
and
this
for you this was severe, wasn't
Yeah,
it?
this is severe.
And it sounds like it's been happening fairly often recently as well. I think today we need to do a blood test in hospital.
In hospital.
Yeah. So there is a blood test that we can sometimes do called a troponin, because sometimes you can get things can become unstable, and I really don't want you to have a more major episode than this weekend. Okay. So let's get an ECG done,
Right.
and then we can have a chat about giving the hospital a call and getting you seen there today.
Okay.
Yeah?
Yes, sir.
Okay. So if you just stay here for a second, I'll just confirm which room's free to have it done. All right?
Yes.
Thank you.
Thank you.
All right, let's have a look at this. So, looking at your ECG,
Yeah.
I think we still need you to be seen in hospital today, okay? So what I'm going to do is call Wexham Park,
Right.
let them know your story and what's happened today. Okay. Hi, it's one of the local GP registrars in Farnham Road Surgery in Slough. Hi, I've got a gentleman with me who had a particularly severe episode of angina this afternoon. He is known to have ischemic heart disease, but this was a particularly severe episode for him and more prolonged than usual. So I think really he probably needs to come in and have a troponin and a repeat ECG. Okay. Thank you. Bye. I'm going to give you a letter to take with you as well.
Thank you. Okay.
Okay?
Thank you for
Listen, I wish you all the best.
Thank you very much.
All right.
For all your help. Thank
No
you.
problem. Take care.
You're their very first patient, so that's terribly exciting, isn't it?
Oh, for whom? For me or for them?
I don't know. OK, so this is Cherry and James. Mr Jennings, come and grab your normal seat. So Cherry and James are both doing their A-levels and they both wanted to become doctors for some extraordinary reason.
Dear.
What do we need to talk about today?
I think I read somewhere
Yeah.
that you do test for, what was it, the thing down here?
Prostate?
Prostate.
Talk about prostate cancer blood tests, is that what you're talking about?
Yeah, you know, so over a certain age, they...
You've had this done before, actually, haven't you?
Many moons ago.
Let's just have a look. You've actually had this checked 3 times before.
Have I?
Yeah, in 2005, 2011 and 2015. And on each occasion, the blood test was fine. OK, so it is only 2 years since you've had it checked.
Well, I didn't realise it had been done this recently.
I've no objection to you having another one, OK, but before we do that, let me just talk about the limitations of the test, okay?
Right.
Because it is very heavily plugged in the media.
Yeah.
So what it's measuring is a chemical that's produced by the prostate gland, OK? And everybody has that chemical produced. It's just a question of the amount that's produced. So, you know, I'm producing it, you're producing it, James is producing it. Generally, young men don't produce very much of it. As we get older, we all tend to produce more and more of it.
Yeah.
And it will also go up if you develop prostate cancer. But so if you see someone who's got a slightly raised PSA level, you know, it's not immediately clear whether that's because they're developing prostate cancer or because it's just a naturally large prostate. Okay. So in that situation, we need to do further investigations. I mean, we would need to examine the prostate through the back passage.
No, I've had that done.
You've had it done before.
OK, well, I think you've set my mind at rest.
Okay.
Do you want me
So
to...
is that a yes or no? Do you want to have it done or not?
That's a no.
That's a no. OK. There is no right and wrong answer here, but I think having seen your previous results, I mean, it would be reasonable to check it again in 5 years' time, or if you develop any symptoms of concern, which is quite a hard thing to evaluate, but something like passing blood in your urine, passing blood when you ejaculate, those things, we should check it.
OK.
OK?
Yeah.
There we go.
That wasn't painful, was it?
It wasn't too painful. No one got an examination. Good. OK. See you again.
Yeah, bye-bye.
Cheers then.
All the best. Cheers.
Grab a pew there. And I think you've come for a review about your back, is that right? Tell me what's been happening then.
I do suffer with my back.
Yeah?
I've done for a while,
Yeah.
a long time.
Yes.
I've got prolapsed L4 and 5 discs.
Okay.
I was making my bed, my back popped. On Friday I spoke to a GP. She gave me 2 milligram diazepam just to try and relax it, but it just got worse. My whole back here, this side is all locked.
Okay, let's have a little look and see. Let me just pop you up onto the bed a wee minute and sort of see.
This is the hardest bit.
Just lying flat, yeah. All right, I'm just going to lift this leg up for a wee minute, okay? Is that hurting you?
Yeah.
On whereabouts?
On the head.
On that bit, okay. Can you grab that leg and hold it for me? Now, if you can, try and pull it up and at the same time push down. Can you feel that sort of?
Yeah.
Okay. Just relax. It's in your sacroiliac joint, it's not your discs that's causing the problem.
Okay.
And that's where your spine and your pelvis join.
Right.
We need to sort of loosen that up. And the way to loosen it up is to sort of gently manipulate it.
Right.
Now, you can do some of that yourself. So what I was getting you to do there is part of it. Okay. Also, if you're sort of pushing down, gently, I know it's a wee bit sore, but that sort of starts to mobilise it.
Yeah.
The other thing you can do is if you bring the leg up,
Yeah.
like so, and then you swing it over around that way hard. Now, it's still quite sore, but if you did that, it'd be hard. I think you'd benefit from some anti-inflammatories around here to try and settle that down.
I can't actually take any
Are you worried about your problem with your stomach?
Yeah.
Yeah.
Because I've got a hiatus hernia.
The best way would be to pay and see an osteopath or a chiropractor to loosen that up for you. you want a hand up or do you want me to let you get yourself up? I know how you feel, don't worry. It's not pleasant, is it? Do you want me to give you a little bit more diazepam as well?
Please, if that's okay. I've been quite lucky, actually. It hasn't played up for a long time. I was quite bigger. I've lost 11 and a half stone.
Brilliant. That obviously helps.
Yeah.